Thanks everyone for coming today. This is one of my areas of interest, and in my practice I see this a lot. I've changed the title a bit. I'm talking about sexual health challenges after cancer and dispelling the myths. So, are we having more sex? Well, actually, Australians are having less. And this was a study done by the behavioural done in 2014, and this was a repeated study, and it shows that we are having sex less frequently, but our repertoires are becoming a little bit broader. And so I think that's sort of after my talk you'll understand what I'm getting at from this. So what is sexuality? So it actually just isn't about the act of having sex. It's actually about who we are and how we perceive ourselves. And it can be just with the way we, our friends, our social beings, political and lots of things that impact on our sexuality. With intimacy, it's about being having that close and familiar. And you know, it doesn't necessarily again mean to say that you want to have sex, but it's actually about cuddling or going out to dinner or doing other things as well. And it's a meaningful experience to the person or to the group. With body image, and I see this a lot in my practice, so it encompasses who we are as a person, and it actually is functionality as well as our ability to relate to others. And sometimes when we have an alteration in our body image, it really does impact on how we perceive ourselves after our cancer diagnosis or after your cancer diagnosis and the treatment that you've had. In my clinic, so I run a clinic and I usually see men and their partners, and often it's a lot to do with education as well. And so we talk about the sexual health response. And you know, media has a lot to answer for. So in the movies, people are always seen to have, you know, great sex and they have orgasms and all the lights go off and it happens at one time. And patients expect that. But actually when you talk them through it and tell them, well, actually that's not right, it happens. It can change, it can be different times, different things can cause, you know, a change in how we react and how we respond to one another. Sorry. This here is going through, it's telling you that your sexual response can change after cancer, and it means that it may take longer to start something. You may miss, you know, it's not a standardised, you go through this section and then to the next section and then you have, you know, satisfaction at the end of it. It can vary and it can change as to what's happening in the relationship. So there's lots of common sexual side effects after having, you know, whether you have radiotherapy, chemo or surgery, and it's loss of libido, desire, arousal for both men and women, lubrication for women, orgasm, dyspareunia, which is painful intercourse, and body image. And also for men, it's libido, impotence, obviously the other word for erectile dysfunction, ejaculatory orgasm, and you know, and just different things in their sperm concentration and their body image. So there's a whole lot of multifactorial things that can cause issues for your sexual health issues. Whoops. So what is normal? So that's what I usually run through with patients. This is normal, healthy people, healthy women. So they actually do have vaginal dryness, some of them. They do have lack of sexual interest. Some of them can experience painful intercourse and difficulty reaching orgasm, and also, you know, lack of pleasure with sexual activity. And so this is before a cancer diagnosis. So you put a cancer diagnosis on top of that and it just amplifies everything. So what's normal for men? So one in 10 men over the age of 40 can have some sort of erectile problem, and usually 1 in 10 of them can also have are completely unable to get an erection. And we know that it does happen with age, and it increases with age. So, you know, 40% of patients at 40-year-olds, 50% at 50, and so on. But it also, erectile dysfunction is multifactorial, and it can be a number of things. You know, it can be your medications you're taking, you know, for younger guys it can be smoking, drinking, taking drugs and things like that, but it can also be relationship things as well. We know that with treatment modalities, so as I said to you, there's lots of issues with treatment. So surgery, depending on where the surgery is, it can cause, you've got to recover from surgery, after any operation, 6 weeks to recovery to get you back to baseline, and then depending on where your surgery was and how you're coping with that. With radiotherapy, whether it's external beam, brachy and things, there's tight, fatigue. You may, depending again whether it's what part of the body has been affected with the radiotherapy, it can be change of body image, it can be recovering, just with acute symptoms and then sort of late side effects of it as well. With chemotherapy, again, it depends on the type and the drugs that are used, and often you'll have this discussion with either the health professionals talking to you about, because some people come across and think that chemotherapy, they're all going to lose their hair, and it doesn't happen to all people. It just, again, depends on what sort of chemotherapy you're on. But there's always that decrease in libido and sensation and other things that can impact on them. With hormone therapy for both men and women can give, a lot of side effects, and and especially with men with prostate cancer, whereas so many men are on hormone therapy, and they can get, the weight gain and the fatigue and hot flushes and things like that, and women that are going through menopause or have had breast treatment and go through early menopause as well. With the new drugs, with the immunotherapy drugs, so any drug that you give is going to have a side effect of some sort. There's always a side effect with it. And that can vary depending on what sort of drugs you're on. Weight gain, fatigue and blood pressure problems for some may affect that. So people will talk to you in regards to that. So when I'm seeing patients in clinic, nurses use a multidisciplinary approach, which is the biological, psychological and social, and people have been talking about that, and Hariana just spoke about quality of life. And I think that it's so important to look at patients as a whole and as to what is happening in their whole world, as well as not just coming in. I run a sexual health clinic, but we don't just talk about sexual health, we talk about what's happening from everything to do with what's happening in their life at the moment. Because often it can just be that they just want to discuss something else that's happening or get something else off their time. It's giving them the opportunity to talk about what it is. And I really like this quote down here, that the medical model keeps me alive, but it's the psychological and social support that enable me to live. And I think that's really pretty powerful. And I think it's, it's very true for the people that I'm seeing in my clinic. So there are a lot of sexual myths around cancer. Can you get cancer from kissing and touching or having sex with someone with cancer? No, you can't. So cancer is not contagious. Does having sex with cancer make the cancer go faster? So I look after a lot of men, and when I talk at the prostate cancer support groups, I often say, some men will say, oh, someone told me that if you have too much cancer, that's what caused my prostate cancer. And then the other guys are going, well, someone said to me, if you don't do it enough, you get prostate cancer. And I was like, yeah, it's a myth. It's all a myth. Does it increase the chance of cancer coming back? So no, this is not true. There's no evidence to support this. So we're in clinical trials. We're looking at evidence, so it's important to have this evidence. But often some people do think this, or they think it and they don't want to say it, but they have this inner fear. Having sex increases your hormones, and can this make your cancer grow? But there's no evidence to support this either. So sex will cause pain or damage. So it's safe to have gentle sex after or during your cancer, but you will have to speak with your treating team, because there may be some other things that you need to do, especially if you're having chemotherapy. You may need to have some protection or something like that through your treatment. I really like this. So I think as nurses, it really is about setting expectation for our patients. And sometimes, when patients see a doctor and they're told that they're having this, and this is, there's a potential that they could have this happen to them. I think it really is about talking about recovery. So I work a lot with men with prostate cancer that have had surgery, and often when they come into my clinic, they say, their continence is good, they're feeling great, and they go, but my erections have not come back. And I said, well, that they're going to take around 18 to 24 months, and sometimes that's the first time they've ever heard that. And so it is about saying, some men may get it back a lot earlier, but I think it's good to give longer than to give shorter expectations for patients. So, and again, it's a very individualised thing, and you assess them individually. Very important, communication to relationship is like oxygen, so without it, it dies. And it's so true, often it's, and, in my clinic when people say, just talk about it, you need to talk, well, actually, it's not easy to talk about, we don't talk about sex when we're having good sex, so when we're not having any, we're not going to start talking about it. So I think, it is about just trying to be comfortable in saying it, and actually, we're in a very privileged position. I'm in a very privileged position because I hear the most intimate things from my patients. And, I say to them, I can understand that it's very difficult to talk about because, let me tell you, I've been married for 30 years and I don't have these discussions with my husband. So it's about normalising things for people and getting them to step through it. It's really good to try and get some questions to take into your consults. So, some of the questions you can ask is it normal that sexual desire is minimal or not experienced after cancer? But I think, again, it's about educating. So, even people, couples that are in relationships and things like that, when you've got kids that are, living at home or mortgages or you own your business, you're on a farm, things, you lose your libido, you don't want to have sex. So it's actually okay for patients to say, I just haven't got the desire. Yep, nope, no one has. But if there is a change in sexual function, it really is about thinking about, okay, well, how are we going to do things sort of differently now? We're pretty much creatures of habit. This is the way we do it. We've always done it this way. But when things happen and surgery or radiotherapy and things change, then we have to think about a different way to do something. A bit like that first slide I showed you about the repertoire. So I like Jane Ussher's work. This is from 2012, and she's done some really great work. And actually, when I first started talking to prostate cancer nurses, I brought this in because when we talk about sexual dysfunction, all the treatments for it, it really is about sexual renegotiation. It is about redefining sex, not just as penetration, but it can actually be other things as well. And sometimes it does take that discussion about what other things you can do. And even simple things like telling men that you can actually have an erection, actually have an orgasm without having an erection. Because half the time men don't know that when they come into my clinic. So again, it's that back again about that education. The Sexual Intimacy in Cancer booklet from your cancer counsellors is fantastic. It's got some really good tips in it and what to ask and things like that. I think, we are trying to educate all our healthcare professionals. It is challenging. I've been doing this for about 10 years. I'm still reading literature about patients don't want to say things in front of the health professional. They're waiting for the health professional to bring it up. Often when I talk at things, people say to me, but you're a woman, and I deal with mainly men stuff, and they go, but do they want to talk to you? And I go, if you feel comfortable, I'll talk to you about anything. So it's just about how you ask the question, really. And there's just some examples of the questions that you can take through and some more resources about the Cancer Council. There are some sex therapists. Sometimes psychologists can help you with this as well. There are online resources. Prostate Cancer Foundation of Australia is fantastic, and also Andrology Australia as well. And I think my take-home tip is that treatment will change your sex life. Don't be afraid to ask the question or bring it up with your healthcare professional, and help is available if you need it. And sometimes the nurse that you see may not be able to help you, but they'll be able to refer you to places. And I really like this. Maybe it's not always trying to fix something broken, but maybe it's about starting over and creating something better. And I think that's a really good tip for everyone. Thank you.